Thank you, everyone. Thank you, everyone, for joining us. I know it's the weather's not so great, so just taking the time to drive over here, we really appreciate you spending a few hours of your evening with us. So on behalf of HP and Vator, I want to welcome you to /X Invent Health. This is the first of a 4-part series that we're going to be hosting throughout 2018. And I am thrilled to have the backing of HP, the endorsement of HP to partner with us to co-host and co-produce this event. So why are we doing this? Why are we doing it in a 4-part series? Well, there's several reasons, so I'll just go over them quickly. Some of you know that we host big splash events, and this is not unlike our big splash events. So why these small salon-style events? Well, one, we wanted to take a deep dive into a topic, something that we're all passionate about, something where we see that there needs to be innovation and also where innovation is happening. And you can't do that on a 25-minute panel in a day-long event. You have to take time and hours. And so we wanted multiple perspectives. And so today we'll get that from venture capitalists, tech pioneers, health incumbents, payers, physicians. And so we wanted to have a 360-degree view of this topic, future of clinics. And we also are going to have behavioral health and mental health in June, and we're going to have precision health in September, and then we're going to have extending life and creating life in November. So an entire series. We hope you'll join us for that. Secondly, we wanted this to be interactive, so we're really hopeful that everyone here will be very intentional and very proactive in contributing your thoughts. And hopefully together, we're not just exchanging information, but we're actually transferring some knowledge, and really that's our goal. So finally, on a logistics standpoint, we're going to be very prompt on time. This is a series, so the conversation will live on, but we also want to be very considerate of those of you who want to get back home. So 7 o'clock, we are going to go to break. 7:25, we will start. And 8:30, we're going home. Finally, sorry.
Some people are flying out too. So
that's right. Some people are flying out to the airport. And thank you, and which it will, right? So finally, I would, again, thank you to HP and also some of our other sponsors, Avison Young. You'll hear from Anthony, Bread and Butter Wine. That is, hopefully you guys all have a glass. And we also have StratPoint and Scrubbed, and they're providing complimentary services to the startups you'll see later. Okay, with that, I am going to pass the baton over to my lovely co-hostess, Fran. She's a super heavyweight over at HP and products, so you have to listen to her. Well, I actually say that because she is a gold medalist in weightlifting.
Yeah, woo. Thank you. I know, right? Attribute I didn't even know I had. So thanks everybody for joining us today. We're really excited to have you. I am Fran Ayala-Samiajula. I'm the global lead for population health and patient engagement here at HP. And we are really honored to have the opportunity to host you this evening. I would like to start off with this particular slide, which is up on the screen for you here, because it brings us back to remembering why HP in healthcare. And oftentimes I hear that, right? What is HP doing in healthcare? Why HP? Least we forget that HP has over 50 years in the healthcare industry. You think back to cardiac ultrasound as an example, HP was one of the first within that space. Medical instrumentation, Agilent was a company that was actually an HP-owned company. We sold off in 1999. And even today, we continue to reinvent ourselves. In fact, the first human genome was actually sequenced on HP compute power. And over the years, as we continue on and on to reinvent, we continue to do it in ways in which we are listening to the needs of our customers. So as an example, just last week, in fact, we had launched a new lineup of products, our Healthcare Edition portfolio, which reflects back to the healthcare industry what we've heard specifically from the needs of clinicians, of providers who are delivering care. And then as a result, integrating things like embedded RFIDs and fingerprint readers, as well as being able to use all of the sanitary components to keep these devices clean. So knowing that they are able to be fully sanitized from end to end are major things that we've done to our technologies. But that's just the start of it. There's a lot of innovative technologies that we are doing today. I hope you picked up the artificial intelligence journal that was left for each one of you. There's a phenomenal case study that talks about how we're leveraging virtual reality technology to change the lives of adolescent and young adult cancer survivors. This story goes on, even as far north as in Portland, Oregon, with Providence. We were applying the technology to help address the ever-persistent challenges of the opioid crisis, where we've been, in fact, able to reduce the use of opioids, help to reduce pain at rest for patients, as well as to reduce administrative costs associated with managing those conditions. These are the types of things that we're doing on a daily basis. As I like to call it, it really defines where we are focused on evidence-based application of technology in the healthcare space. And for this reason, amongst others, we are looking to do very significantly meaningful work within the space of health and life sciences, and we welcome all of you to be a part of it. And this series is just one example of how we go about doing that. So I want to thank you once again for your time, and it is my great pleasure and honor to introduce you to Dr. Archana Dubey, who's our medical director for the employee health program here at HP. Thank you.
You can advance the slides. Hi, welcome to Invent Health. We are talking this first of the 4-part series that we're talking about. These are trending topics that we see in all of your spheres of work. And hopefully each one of you have your hands or feet into healthcare. And first of this topic is the future of clinics. And as working as Global Medical Director at HP, part of my day job is to look at what's out there. So we have invited all of our VC panel folks and then people who are actively participating in reinventing a future of clinics. And why are we talking about? Because we are shifting the definition of clinic as we see it, as a brick and mortar establishment, and focusing onto the place where outpatient care is given and medical treatment is given. So the place can be not just a brick and mortar. It can be a virtual space in which you can extend care and give access to treatment. So with that focus, why is the reinventing of clinics happen? Is that an Amazon effect? So we were looking at, is the retail market coming to healthcare? Yes, it is, because we are noticing that access to care is limited because of the physician shortage. Because we have, for example, at HP, we have about 50,000 employees, and they get care in different regions of the places where they are focused on. So in Bay Area, for example, we have a physician crisis. We looked at that, and we have our on-site health centers that are providing access to care. Not everyone can do that. So most of the places that you will be talking to, like Sutter, Kaiser, they are starting to look at access to care, how they can extend from brick and mortar to like tele or other presence. Cost of healthcare. 18% of our GDP is coming, is spending towards healthcare. And this has gone up in the last 50 years from 5% to 18%. So stakeholders like self-insured employers like HP or Microsoft or Google or Facebook or payers like Medicare or insurance companies and patients are starting to look at how can I get care at lesser cost. Changing landscape. We are seeing baby boomers. We are seeing new conditions. We are seeing chronic conditions. So, for example, diabetes is a chronic condition. We never thought cancer could be a chronic condition. It was a catastrophic condition. More and more people are living through it, and it's becoming a chronic condition. Culture shift. Healthcare. Being a practicing physician, we are shifting now from volume-based to value-based care. We're shifting from sick care to wellness or well care. So those are things that are starting to shift, and we are starting to look at how do these clinics in future will be delivering care for us. Patients, they're expecting better, and they're expecting things now. So if they have a problem, they get on their computer or Mr. Google or Dr. Google, and they find their skin condition could be a melanoma, or it could be just a little mole. So those are things that we are starting to see. And the most important is tech enablers. Fran just talked about how technology, every technology company is getting their hands into healthcare. And HP has been doing it for a very, very long time. But the new technology, emerging technologies, are enabling the providers, the health systems, and most importantly, the patients to be able to deliver or get care soon. Artificial intelligence, machine learning, big data, remote sensors, and smartphones. The phones that you have with the geopositioning, they're taking care of your sugar levels. They're seeing how many steps you're taking. All of those is creating medically important data for a provider to deliver care. So we are reinventing clinics in the Amazonian way, in a way.
So Fran talked about sort of the tailwinds, what's driving us to innovate. But I wanted you to just visualize what's been happening. So how did we used to get care? Well, actually, in the 1960s, 40% of doctor engagement was through a family doctor house call. How many actually had that? It's amazing. Wow, that's great. I mean, that was real care. Now, by 1980, that was under 1%. And now we are familiar with neighborhood practices, but as Archana pointed out, we have a doctor shortage. I believe it's about 100,000 doctors that we have that was said by Association of Medical Colleges. And really, this is what's most astounding, and this is the reality, and this is a problem, which is 141 million people went to the emergency room. Almost 1 out of every 2 people go to the emergency room. And I found a list of why they go. They go for primary care. They go to get a prescription. Here's a funny one. They go to get a back-to-work slip, and they go to get a pimple checked. That is a problem. So that's why we need to reinvent clinics. And as Archana and I were pulling this together in Fran, we thought, okay, what are some of the things, just to create a framework for the venture capitalists up here, what are some of the things that we're seeing? Also, who are some of the companies that we invited? So there's lots happening in telemedicine and on-demand. So we'll have Just Answer here, which provides on-demand physicians. Digital therapeutics and wearables. 1 in 6 consumers own a wearable device. We have walk-in clinics and pharmacies, so we will have Sutter and Walgreens here. Walgreens has 400 clinics inside of its 400 drugstores that have clinics, actually. Employer-run workplaces like HP. 50% of American businesses will offer on-site clinics. This is up from 30% in 2014. Then you have these new insurance providers like Health IQ and Oscar, and then these verticalized insurance providers. Oscar is becoming one of those, Kaiser and Sutter, of course. And then the emerging, just fully integrated clinics with wellness facilities. So that's something new as well, and Oscar will be here to talk about that. So given this backdrop of sort of innovation already, we wanted to invite the VCs here to talk about, well, which one of these are they backing, or maybe we don't have something here and they're going to share that with us. And we also want to invite everyone here to please participate. So probably within 20 minutes we'll open this up. Yes, we'll open this up, and we want everyone to have, I don't know where the mic is, but yes, Arthur will have the mic.
Yeah, so raise your hands and we'll get the mic to you.
Yep.
Yeah.
Oh, okay. So Archana, do you want to kick off this panel?
I could kick off this panel. So we'll be talking about how we receive care and what does care consist of. So initially we thought we would introduce each one of you, but I think you can do a better job of introducing yourself and then also your investment philosophy and how your investment philosophy is actually directly impacting the future of clinics, the way we want to see them, not the way we know today. Yeah. So let's begin with Dave.
Okay.
Yes.
Thank you to HP and to Vator for sponsoring the event and including us. Delighted to be here. Dave Schulte, I'm a managing director at McKesson Ventures. We have a $250 million venture fund. It's all McKesson dollars. And we invest in healthcare IT and healthcare services. And largely those investments are focused on what we call the pharma value chain. So anything that impacts pharma, pharmacy, to some extent PBM and payers, but we're largely focused on that part of the healthcare ecosystem, and less so on the direct provider landscape. So I'll stop there for now.
Michael?
Hi, everyone. On? Yes. Hello? Oh, there you go. There it goes.
It's working.
Okay. Michael Yang, Comcast Ventures. Comcast Ventures is the corporate venture fund for Comcast Corporation. We're a broad tech venture fund. I lead our healthcare investing area. And the two areas within healthcare that we like to focus on are products and services that go to market either direct to consumer or through the large self-insured employer angle. So most of my investing has primarily been along the lines on the employer side. I work extensively with our human resources and benefits organization. Actually was on the phone with them for 2 hours today, and we have been primarily joined at the hip in terms of selecting solutions that we will dog food ourselves as employees, and then hopefully there's a subset that are potentially investable candidates for the venture fund as well. But Accolade is a big investment that we've made on the employer side, navigation for members. And then on the the clinic side, I had the opportunity to introduce Q-Liance into Comcast, and that was trialed for a year with our Seattle population. Also introduced Crossover into our benefits organization, and Crossover will be running our New York on-site clinic. Comcast, so you guys know, has a handful of clinics historically internally run. You might know Dr.
Yes.
Tanya Benenson.
Yes.
She's our chief medical officer. She ran the New York clinic. We have one in LA and a few other locations. And you have the constant debate versus owned and operated versus outsourcing to a third-party provider. We are also, as a corporate employer, customers of Doctor on Demand. So we selected them as our telehealth solution. So happy to speak on any of these.
Did you invest in that too?
We have not invested in that.
In the Doctor on Demand?
Great.
Okay. Thank you.
Good evening. I'm Ursheet Parikh. I'm one of the 5 partners at Mayfield. Mayfield is a broad-based fund. We are a 50-year-old fund investing across the spectrum, quite a few active companies in healthcare and bio-IT. Our focus is we're really looking for solutions that have very, very high sustained user engagement and behavior change, along with platforms for precision everything. So precision wellness, precision care, precision diagnostics, and precision med. Some examples of companies that are directly related out to this theme. So healthtech around telemed, Lantern around behavioral and mental health on the phones, Zipongo, which is about making it really easy to eat well and have a population scale impact. Qventus, which is becoming the dominant platform for AI to augment care providers in clinics and hospitals. And it essentially just tells people what they may need to do the moment they need to do it, and some good magic happens. We have an investment in a company called Mammoth Diagnostics, which is CRISPR applied to essentially creating very precision, essentially a sheet of paper that can pretty much diagnose anything with blood, spit, or urine kind of stuff. Mission Bio, which is doing sequencing on a per cell basis so that you can kind of get the genealogy of tumors, so that you have the right prescription to prevent relapse. So that kind of gives you a sense of the stuff. Most of these investments are Series A investments. And in terms of which types of customers, we are investing in companies that sell direct to consumer to through employers. Payers, we had one company called Brighter that was recently acquired by Cigna. Also that sell into the pharma ecosystem, and then, as I said, sort of diags, and precision meds, so all of the above.
Do you see this precision meds, medical solutions playing out in the future of clinics at this time? Have you thrown them in the sandbox?
So I think it is showing up. So precision med in the clinic, I believe, is really starting out around cancer. Okay. In a pretty big way. And in some sense, if we think about it, new tech costs more. It probably goes to the higher end of the market. And in healthcare, the higher end is the higher ticket cost sort of condition. So while We think that there's big opportunity on the chronic condition side. And there, I think there's personalization more than precision. So I'm not so convinced that a genomic test and then sort of figuring out your exercise routine is going to be as effective as just personalizing and finding a way to kind of create a virtual assistant that really makes it easy for you to just get what you want, get it delivered, things like those. So that hence something like a Zipongo on the wellness side, but with on the cancer side, something like Mammoth or Mission Bio stuff.
Great.
Good afternoon. I'm Alex Morgan. I'm a principal at Khosla Ventures. So we invest broadly in a range of technologies, everything from a rocket company, Rocket Labs, all the way to a vegetarian hamburger, Impossible Foods. But I focus primarily on biotech, machine learning, data science work. But I'm also a medical doctor by training, so do a lot of touch many of our things in health. I guess our portfolio in biotech and healthcare is probably too lengthy to go over now, but many of you may be familiar with our founder and head's theses in the application of machine learning and AI to health, Vinod Khosla. And if not, he has a wonderful, lengthy document, which you can find online, which is actually made, because of the pace of innovation and thought, has maybe aged a bit, but it was certainly very strongly differentiated when he originally wrote it, I guess about 5 years ago. And we've continued to evolve our thinking in the space, both from having made investments aggressively along the lines of that thesis guided us for. So I actually should pause for a second. I would apologize. I actually had a minor medical procedure done this morning, so I had Versed and fentanyl this morning. So I'm about 6 half-lives out. But so I actually should mention that. So if my short-term memory is maybe not what it usually is.
I told Alex it was okay. We would just make it up by drinking more wine.
Yeah.
More wine, yeah. Yeah, that might undo it.
Yes.
So anyway, I'll hand it over to my colleague, Scott.
Alex is tremendous, so if he slows down, I'll just pick up. So I should also start by saying thank you to HP, thank you to Vator and Bambi. It's an excellent panel, and somehow you let me sneak onto it, so I'll take the challenge. I'm a partner at Data Collective. We are early stage investors in deep tech and deep compute. It's not across all parts of the economy. It is across some pretty large silos, often enterprise, often around like the future of humanity, the future of health. I would say along with Alex, actually, there's a pretty massive portfolio there in computational biology. And I am but a partner to that, just kind of a kid in a candy shop. I lead an adjacent portfolio called computational care, which is a concerted but patient effort of asking where and how you can push that compute closer to the patient and closer to the person who touches the patient. And just to give a spectrum on that as to where we have religion and not, that could be things, I don't want to say flippant, but there's no hesitation to be direct to consumer and to envision entirely different models of how the clinic or the interaction will work surrounding the patient in the future or the consumer. While at the same time looking at the bowels of the beast of a pretty dysfunctional healthcare system. I think you cited 18% of GDP. When I do downstream cost analysis, I come to about 22%. I mean, your number is the accurate one. My number is the one of what I think the all-in, if we actually accounted for things for the taxpayer the way we do in Western Europe. And so my point is that we're also not afraid to take a crowbar to the oligopolistic systems that are the reason that that's 22% versus 8 or 9%. The joy and the stress of what I do, if I look for one way to talk about it, is we're pretty early stage investors. We're about a little more than $1 billion in capital under management. The fund is about $240 million, seed and Series A. But most of our investments are before the company has taken $3 or $4 million of capital. So what I'm usually looking for is something I can deeply believe in a plausible future where I think this is a wedge, or the word I'm increasingly using is a crowbar, into this big oligopolistic system. So trying to envision long-term second and third order system change, but yet my daily job is to find specific things that make a dent in that system and then come along and support that founder on that journey. So I could give a couple examples, but I've already surpassed my word limit for myself. So happy to give examples along the way.
We'll get into, I do want to you brought it up about future of clinics. I definitely, one of the reasons why we have this evening on the future of clinics is because we want to focus on that. So one of the things we wanted, for Archana and I, when we think of the future of clinics, we think of, new ways to access care, whether it's on your mobile device or at CVS or Walgreens or on-site clinics. and it's also what kind of care. So it's, you know, it's not just a pill anymore, it's wellness services. And so when five of you think of the future of clinics, what gets you excited about, what does it mean to you, and what gets you excited about the opportunities there? Anyone can start.
So I'm probably the decidedly low-tech person on the panel in terms of maybe where we've made some recent investments. And so the specific answer that I would give to your question is what gets me excited about clinics, the future of clinics, and where to make investments or where there are opportunities is things that significantly lower the cost and improve convenience or access. And I think technology will be an enabler to those things, but I don't think it's necessarily the requirement. And so we've recently invested in an infusion center business, and it's a really simple thesis. It's 30 to 40% lower cost to get an infusion in a retail setting than it is in a hospital. And it's more convenient for patients. And they're doing this in sort of process redesign and patient-centered design ways. There's some technology, but it's mostly thinking about what does a chronic patient who gets 6 to 12 infusions a year, average infusions of 2.5 hours per infusion, what will meet the needs of their life? And in this case, that means evening appointments, weekend appointments. It means infusion suites that have couches or TVs for children and family members to join them during their infusions. It means, a desk so that people can take phone calls and do conference calls during their infusions. And so it's thinking about a retail setting in the true sense of what that means. Really small things like calling a patient an hour before their infusion and saying, we're just confirming that you're going to be here. And then we start mixing the drug and prepping the infusion suite 15 minutes in advance of the patient arriving, so there's no wait time in the lobby. And so this is an example of a business we're excited about. I think there's all kinds of technology components that will change the future of clinics, but some of it will also be workflow redesign. And some of the technology, like AI and machine learning, will be applied to back office things like prior auth. Making prior auth more easy for the referring physician and for the patient. Scheduling continues to plague the clinic experience, the retail patient experience, why we can't make scheduling easy. That is probably a technology solution.
So it seems like you're focusing on the patient experience in general with your specific focus on the infusion side of it, but the pharma side of it in a way, and making it efficient by process flow. But absolutely, I mean, there's technology play in the back end, what you're saying. When we do have pharmacy benefit managers, they're looking at somebody arriving to a transplant or arriving to an infusion. There is a process in place that they could do so the patient doesn't have to delay care. Yep. So it seems like it's a combination of those two can factor into your future of clinic looks like patient-centric and experience-focused.
So, to the point on, what is going to drive the cost of care from 18 to 22% to 8 or 9%. Mm-hmm. So nobody in the existing ecosystem wakes up thinking, how am I going to have my revenue cut in half? Or how am I going to give twice the value to my customer? That is what we see as one of the biggest opportunities. So essentially reinventing a care model and becoming some sort of a care provider. And then finding a way to have very, very high user engagement, along with a way of either plugging into the existing ecosystem or creating new business models, kind of creates that. And so one company that we've not invested in that I'm a big fan of is, for example, Forward. Yeah. Right? And if you are a patient at Forward, it's life-changing, simply not because their doctors are that much better, but scheduling is 2 seconds as a text message. And it shows up directly out on your phone. And you can see how that better patient experience. I go and see them 6 times a year, and I don't spend more than 5 to 10 minutes in the clinic each time I go there, and so it tells me that it's actually costing them a lot less to have an engaged, healthy patient than this model where I would call in first, go get a physical, then get a prescription, go get a bunch of labs done, then go back again. And all this, it's just, so I think, so the summary is, I think, reinvention of the care delivery model with the focus on just what should it ideally be, I think is the biggest opportunity from me as an investor.
I did a field trip to Forward, and it was phenomenal. And it's almost, their model is very much like it's not in a negative way, but keep the patient out in the life that they live in and utilize the highest cost asset or resource as little as possible by using technology. So I do feel that it's more provider-centric, actually, that solution. Because now you focus on provider time and making it efficient so you can actually give better care to your patients in a more efficient way.
So I think the right way to think about it is it's like, how do you find the balance for all the stakeholders, right? So like when I was referring to this company Cuventus, it's one of those instances where when we did reference checks on them, even when they were very early seed funded, the doctors loved it, the patients loved it, the nurses loved it, and the CEO and the chief operating officer loved it, right? I mean, that's like, how do you kind of sort of, because I think it doesn't have to be one or the other. I think if things can be redesigned from the ground up, I think they can kind of actually deliver all of the
Ursheet, not to, because I want to hear from everyone else too about their definition of future clinics, but do you think that a company like Forward, and I think it's an amazing company, do you think that makes it accessible to an elite group of people, or what about, does it make it accessible?
We're investors in Forward, so I don't have I don't interact deeply with the company, but I think you asked initially, what are you excited about investing in healthcare? And I think that's one of the key things, is that we are basically a healthcare investment is ideally, and sometimes not always, but ideally an investment in creating more opportunities and for improving health. So that's intrinsically a social good. It's a good thing to feel good about. If you don't invest in something that is successful, well, you missed out on making money, but you maybe helped them with some advice and they did something good in the world. So it's a sort of win-win situation to be involved in healthcare investing.
And you work for a venture capital company?
Yeah, but it's a good person. You have personal motivation, right? I mean, the thing is, you want an investor that basically thinks about this, works hard as you do, ideally, wakes up, thinks about it, goes to bed thinking about it, and then wakes up at 3 in the morning because they just had a thought and goes back to work. I mean, that's what you want, someone that cares about this, right?
Yeah.
And so the flip side of that, though, as mentioned, it's 20% of the economy, and it's a part of the economy that really, on most of the key returns on investment that we have, there is not a worse outcome. So $1 in terms of improving health and wellness into traditional healthcare is you can put $1, whether it's road improvements to reduce accidents, whether it's investment into things like autonomous vehicles, which are going to have a huge impact on quality of life because accidents affect young people disproportionately. All kinds of things you can do with $1 not into healthcare may actually, in the current system, will probably have better returns on wellness and health. So that means, as Scott said, there is an enormous opportunity to do wonderful things and make money and help lots of people. Returning to what you said, what the exciting thing about the kinds of investments that we do, we're very tech-focused, and those are often about technologies with scale. One of the great things about technologies which are software or data-based is that they scale and get better at scale. And that means, sometimes people will say it's a kind of a Silicon Valley way of looking at it, but what are poor people going to be doing in 10 years? Well, what are rich people doing now? And if those are things that there is an economy of scale built in, whether it's a network effect through data or a technology like HP that you suddenly can build in a much more efficient way, then suddenly it's a thing that you can bring to the world. How many people here have a standing desk? Okay. How many people read an ingredients list before they eat something? How many people have been to a dermatologist? Now, you don't need to raise your hand because there's a lot of sensitivity, but how many people have talked to you just think to yourselves, a psychologist or psychiatrist? You don't have to, I saw you, okay. So, well, no, okay, yeah. So, but what I'm saying, okay, so the point of that is that I don't think it's actually a bad thing that it's 20% of our economy. Healthcare is actually moving out into all our other industries, right? Your furniture is becoming a medical device, right? Your food, right? what, you eat 3 times a day, you have nutritional questions, and you're not just eating the food of your ancestors or what you happen to grow in the climate that you live in now. You're making decisions, many of which are guided towards goals related to health and wellness, right? So the economy of food, all the way from production to distribution to basic productization, is actually becoming a medical industry. Beauty, right? You think about your appearance, that's becoming a medical, I mean, it is a medical discipline, but basically it's becoming a medicalized area of our economy. Even something as simple as how you feel is actually becoming medicalized, right? I mean, you don't just feel the way you feel, you actually go and you study it, you seek to optimize it, you listen to a pop psychologist telling you what to do. You're being interacted with by many digital devices that actually use psychology and data science to manipulate essentially your dopaminergic response. So instead of thinking about it's 20% of the economy and we're going to shrink it, I think it's going to become a huge part of the economy is going to have biotech and medicine built in. So those are all reasons why I'm excited about it.
That's good. That's a great point, but I think it's not so much the wellness part of it that I think people want to lower and fix. It's the part that it's sort of like advertising 50%, you don't know where it's going. It's sort of like 40% is redundant spending, right? Because there's people doing multiple procedures when they don't have to, multiple MRIs when they don't have to. I think it's those excessive spending, I think, that we want to happen.
I've heard a lot from you. There's lots of things which are waste and are not good. I think another framing that might be helpful is actually to not think about the future of healthcare aligned in the same way as a single company like Amazon, which is a kind of commodity distribution channel, but in a way closer and more analogous to education. So what we've seen in recent decades is there was a big shift in privatization of education, and that actually improved a lot of consumer access to education. So back in the day, you would have, for secondary education, you would have to go to some college town, and if you were a working person that wanted to have continuing education, it was actually not an easy thing to do. A lot of for-profit colleges rose up and they said, okay, there's an office building right at the exit ramp off the highway, I'm going to put a college there, and people coming home from work can start working at an executive MBA. You actually increased access to education. Those private and for-profit education groups were very aggressive in online learning because that was a money-making opportunity. Now, not everything went well in that space, and if you guys there's an excellent Frontline documentary called College Inc. About many of the problems in for-profit education, but it actually shifted a lot of access to education, which is, I think, similar to healthcare in that it is an outcome that we actually have a very hard time quantifying or describing what we really want, right? The goals are, it's really hard to quantify what we want in education, sort of like maybe pornography, we know it when we see it, but when you actually try to define it carefully, it becomes very difficult. So I think and historically, there have been many of the same geographic monopolies around education that we have had in healthcare. So I think if you're going to reason, so you're going to reason by first principles, which is probably a much better thing to do, but if you're going to reason by analogy, I might not look at commodity sales channels like Amazon, but more towards how education is evolving.
So how do you address that, since we are talking about Amazon so much, how do we address Amazon joining hands with Goldman Sachs and other folks to start their own way of addressing healthcare in general? Not just the cost part of it, but the care delivery part of it. And just kind of bringing it back to the future of clinics. How does that pan out in how the future of clinics would look like when large employers will start to create consolidated cost modeling? And yes, sir.
Scott, you haven't spoken.
Go ahead.
You go ahead. My answer on this one is strong. So go ahead.
we like strong.
Yes. Go ahead. No, please.
Okay. Go ahead.
So I think the biggest innovation in the ecosystem is basically coming from people who are carrying the risk on a population. So this is employers and I guess Medicare, right? Yeah. And what that is basically doing is this is the opportunity. So I actually, for what it's worth, I actually disagree that, let's take healthcare and make it 30-40% of the economy. Because if you look at the Federal Reserve data since 1970, the employer cost to compensate employees has gone up 60% in real dollars, but the employee wage on average has actually been flat. And so all of that 60% has gone into the cost of healthcare. And with 2.5 members per employee, That's $25,000 in premiums. That's beginning to become a middle-class wage in most of the country. You overlay that with how much education plays a role in careers. You have 60% of the country that hasn't gotten a pay raise and feels that they will never really get ahead. And so immigration, others will cut in line. So I actually think that employers are really, it's becoming a core American competitiveness issue. It's a boardroom issue. It's a top issue for all the, just the leadership and CEOs. And that is what is going to sort of drive this change. And what that means from a future of clinics is innovation comes faster. So I think, just as you have, one would tend to think all this great wellness stuff, products like Zipong, yeah, the insurance plans are only now catching up to it, right? The people who took it, their first $1 million ARR customer was Google, right? And then Disney, and then Nestle, and IBM. And so I think we see this innovation come faster mainly because of the fact that it'll be the Amazon and the Berkshire Hathaways and the Microsofts and the Googles and the Facebooks who are really, Comcast, who are really taking charge on how
HP.
HP.
Well, I have to bring HP to them.
Absolutely.
So the strong answer. Then I have an additional question as a tail end of that too. Yes.
Try to use as few words as possible I want to give my flavor on Amazon and then connect it to what I'm excited about. So if there's a spectrum of, oh, this is a really big deal on one hand of the spectrum to, oh, don't you remember there's been like 7 really large employer groups who've gotten together and say, that's it, healthcare's broken, we have to solve this for the future of our grandchildren and our competitiveness, et cetera. I'm on the side of the spectrum that is on the far passive radical that this is a really big deal. And I'll tell you why, which is I could not find a bigger pool of capital that is willing to take 15-year patience to say, I don't want to be, I'm mainly centering on Bezos when I say this. I don't want to be a services business, but I will not succumb to just playing by the oligopolistic rules. And even if it takes me 10 to 12 or 13 years, I will find a cash flow positive way in the long run to do a fixed investment that just waits it out and takes out that part of the economy so that it then works more efficiently. So I think, sure, we'll see them pull together as a certain type of employer, which is what most people think, okay, that's what this really is. I think they'll buy or take out Premier very quickly. And suddenly they're in the middle of the supply chain on the medical side. I think they look at the pharmaceutical supply chain, and there's no sharp elbows towards our friends at McKesson when I say this, and look at the impact on market cap and say, well, actually, maybe we don't even need to do anything. We're clearing out a bit. There's actually no more TPMs to disrupt. They're all at this point owned. And then I think they sit there and they watch for a year or two, and particularly sitting on the medical supply chain, and they'll just say, oh, this whole hospital thing is really, really inefficient. But they'll say, we don't want to own hospitals. I live in a future where you could take almost every interaction, if you are liberal in your definition of it, and it becomes a bundled episode. And so I think Amazon is the one wedge that could help dictate what math and CMS have known but failed for the past 10 or 15 years, which is most of where we get care when it's going to be expensive should be as part of a thoughtful bundle. If you go into the math of bundles, where I get excited are the second and third order, which is this one thing to say, well, what if hospital systems didn't just price as a dysfunctional economic system, but had to actually compete on the bundle of, say, the 12 months surrounding your knee replacement, as an example. Well, it turns out they get relatively competitive, and you can cut the line off so that it's always someone above average in quality, but competing to an average or slightly below cost. And there's second and third order effects. Now, why am I excited? Is that in that world, if you close your eyes and think about the last time you went to a primary care physician, I will pound this table that in 15 years, it looks nothing like the last time you went to the doctor. And my projection onto that is that that primary care will be functionally much broader than you're actually experiencing. When we create these silos, which are none of our faults, of mental health, the clinic, the triage, where and how you're walking along very closely to a type 2 diabetic, we get into these various silos that in the future, that will all be part of a team-based, clinically driven, data compute shifted towards the patient environment where all those things are part of your primary bundle. Primary care will be much broader. But then the second thing I'm saying is it'll look like it was made for you. So my closest example would be, we're also early, small investors in Forward. But I would say if you are a working late 30s professional and your employer works with crossover, and if any of you have had a chance to touch that experience, that's the closest example I could give to what it will look like. But then I would say, well, imagine you had crossover for my mother when she's 68 and she has these 4 comorbidities. It's going to look entirely different than whatever my daughter's going to be going to when she's in 22 and living in New York City and hopefully will text me on occasion. And so my point is that in some ways they'll become much more branded, consumer-centric, verticalized, probably full stack. Each one will feel like, oh, this is something that actually fits to who I am. And it will literally have brand. We've not seen any true brand. And then the other way, it'll be very functionally broad and very clinically computable. So I'm excited about that. I think that would be great.
At 5 years, 10 years?
Oh, I totally cheat. I am 100% confident if you give me 15 years. So as an early stage investor, what did you say, Matt?
Yeah. It seems like the clinics are becoming like an operating system in which you can download your apps, so to say, or pick your apps and create a modular experience for yourself for what you need in a way. So, a crossover or forward of, we have premise health centers, they are trying to create that experience, but it's largely going back to your point is it's been asserted by the self-insured employers because not just the cost, but they also value the talent and they want their experience to be the core center of the healthcare delivery. Anyway, so you were saying?
Yeah, so I'll swing it a different way, which is I think the problems that have been talked about so far are privileged first world problems. And the state of healthcare in America is such that we frankly don't even deserve to be talking about them because we fundamentally have far more primitive kind of crawl problems, not even walk, not even run, not even kind of whatever the next thing is. So, I'm talking about people, a family of 4 that will go to the ER 30 times a year because they were never taught to even, there was an option to get a primary care doctor and you can go for an annual physical, right? So they are incurring $5,000 to $10,000 a pop times 30 to whoever is underwriting that bill. Just simply giving them a nudge. Did you know? And we're actually happy to go find you a PCP that's near your home on the way home from work. That is cost reduction right there of a massive magnitude, going back to the waste thing. It's fundamentally a set of literacy, to your point, which is we're not smart enough, and the influx in the demographics and poverty and other kind of social economic drivers are not allowing people to be consumers, let alone sophisticated consumers to even take on consumerization of health, right? So I focus more on what I would say access, I would focus on contextual barriers, I would focus on societal kind of impacts, this kind of stuff, just to level the playing field, to have kind of normalized participants in kind of the healthcare ecosystem. Because I think waste and utilization is the dominant thing before you even have the right to service people because they're living longer, they have more chronic and all that kind of stuff, right? And again, we live in a privileged geography in the country where people have therapists, they go to, all your questions, Alex, you go anywhere else, they don't even know, the hospital's that big building in that other town over there that they see on the highway, but they've never been, right? They don't know people in their own kind of network that even, are fit. They have generations of people in their family have smoked, so you grew up knowing that that's what you're supposed to do when you hit 17. So that's the cycle that we're focused on, which is why, for better or worse, tech-enabled services is frankly where we've tried a lot of software, we've tried a lot of other kind of DIY solutions, but tech-enabled services where there's a human person that is going to bond and ultimately be that coach in the corner of a patient, a member, an employee, whatever you want to call it. That's why we have found as being most efficacious at kind of moderating behavior and ultimately driving positive outcomes, both quality and cost in healthcare. So that's our end.
You're absolutely right. It's an urgency right now because as population is large, there's a bottleneck in the current clinic situation. And there's health literacy issue too. And even amongst us, there is plenty of folks who may not know what a melanoma means or who may not know what an urgent care means between urgent care and emergency room. So there is a lot of health literacy issues. And I do feel there is a technology enabled and there's a human touch enabled solution that it has to be backing up the technology enabled solution to scale it for this urgency that we are facing because of population being large and providers being less. I want to welcome Casper back to the table.
I am so sorry, everybody. I thought it was later. For some reason, the schedule changed.
We spent the last hour talking about collective and Juventus. So
Oh, good.
no, I say crossovers.
Crossover.
Yeah, we have been serving crossover to the table. So, so yeah, welcome. And if we can just ask you all the questions, then would be good. So definitely begin with introduction. We all introduced ourselves. What's your philosophy of investment? And then we can continue.
Great. So Casper de Clercq, I work for Norwest Venture Partners. That's Sean. Lots of familiar faces. And I'm really sorry. I was actually down you watching a catheter case. Here we are. Catching my own breath here. So, Norwest Venture Partners, we actually just announced that we raised $1.5 billion fund. We tend to invest sort of $10 to $15 million, amongst others with Ursheet and Juventus and Sean and Armada. And I guess let me just speak up this way. We're investors in Crossover Health, which I think has since become Apple Health. When you look at what Apple is doing. And I could certainly talk about that to the extent people want to hear a little bit about Crossover Health. But I think as a philosophy, as an investor, we invested in, and I'm glad to hear some of the commonalities there, that we invested in both Armada and Crossover, because I think there's a fundamental human element that you need to include in healthcare. It can't all be software, it can't be bots, it can't be technology. That if you want behavior change, you have to involve human beings. And that was one of the central tenets about investing in Crossover Health, is that that sort of, if you take it from the, instead of outside in, you take it inside out, which is get an employee engaged with somebody who cares about their well-being, and from there you can go everywhere in terms of their healthcare. So that idea of a central repository, a central place where people can come, I think makes a huge difference on the healthcare front. Now, to be honest, I think companies like Apple or Facebook, they'll do everything but change your diaper, because they want to get employees as active and engaged as possible. And so you'd say, well, can that be extended out into the general population? Will this work in the Midwest and so forth? And it turned out that Crossover had tremendous success with a company called HEB, which is sort of the Safeway of Texas. And they had a dramatic impact on COPD, congestive heart failure, diabetes. And it was because those employees felt incredibly appreciated and then empowered and engaged. And they saw dramatic change in terms of the healthcare claims subsequently.
So Casper, since everyone had a chance to talk, I'm going to have another question for you. But we do only have, what, 8 minutes? 8 minutes at this point. So if you do have a question, you should really raise your hand or stand up so we can definitely incorporate you. But I do have a, great, you're going to be first in line. Was that a question? Yes, it was. Okay, great. Second. Okay, for Casper. So your future of clinics is obviously an investment in Crossover, which is a brick and mortar clinic, but you and I have talked about telemedicine, which is another, telehealth is also the future of clinics. But then you said something to me about there is a race to the bottom, and I'm not quite sure which, because there's a number of different type of telehealth services or digital therapeutic services that are offered over telemedicine. So elaborate on that.
Sure. So we did not invest in Teladoc and the half a dozen other competitors, and I think for good reason. If you look now, Kaiser is offering it for free for their for all of their members, and so that really was a question not about engagement. That sort of it goes right there with nursing hotlines and other ways to basically find some efficiency in the network, but I didn't see that as a sustainable business from an investment standpoint. Is that anybody can, we all can Skype, right? I mean, what's the difference? There's not real technology value in Skyping other than maybe making people a bit more efficient. So I just didn't see that as a really a fundamental transforming thing in healthcare.
Yeah, can I make a point on this topic? I mean, I think there's the question of, does it lower cost for the system? And is it a sustainable business? And I think in the area of provider businesses, the clear trend is that those businesses that are taking risk are viable businesses. So Landmark Health is a business that we invested in. And those businesses that are moving care to the home, but it's not just doing home visits, it's actually taking capitated risk for the outcome of those patients. And so I think, I agree with Casper about the unit economics of pure telehealth may or may not be a good business. You've got to be taking risk for the actual outcome of the patient for it to be a viable financial business.
So, I mean, this is like it's whole product model. The whole product is health, and you have this, you have a minimal viable product sometimes in the space is actually trying to provide health. Now, sometimes you have a particular thing where you have IP and you have a therapeutic or something and you can do something, but if it's just healthcare, then the whole product, the MVP really is actually health. So I think that sort of plays into that model. I think when we talk about the future of clinics broadly, it's important to remember, you say what's going to happen, and to kind of Scott's point that things are going to be very different. When you do go to a clinic, some people think they're going to get a detective, but it's really much more like you go to a parking attendant and they look up on a table to see what zone you're in and give you a ticket. And they charge you like you went to go see a detective. And so there's lots of opportunity to do things differently. When we turn to like what kind of experience we have, I asked this question a second ago for the audience about psychiatry. We have a company portfolio, Ginger.io. And it's on your phone, and your phone knows much more about your psychiatric state than you're going to provide to someone, even a very perceptive person, in a 50-minute one-on-one interview once a month, once a week. It's just by the nature of data flow, because individuals are variable. So the future of clinics involves lots of different technology. It's interaction with people through different channels. It's collecting data from different sources. One of the things that I worked on in my PhD work was on whole genome clinical interpretation. And it's clear in that space that a human being cannot interpret a genome. Now, it may take millions of dollars of work to build an infrastructure to interpret the first genome, but then that's a technology that scales. And at first, what seems like a technology which is very niche and very proprietary and available to a few, because the technology of actually sequencing gets cheaper, the software of analytics becomes something that scales very efficiently.
Does anybody
There
else?
is a question.
Yeah, right here.
Yeah,
I have a question on Forward. Having signed up and everything, I think it's a brilliant idea. I was at Westfield Mall. It was great. I could get coffee, an ice cream. I could see a movie, go to Nordstrom's. It was fantastic. But when I went in, the main thing that I needed was a chest x-ray, and that they don't provide that. So my question is, one-stop shopping equals compliance. And so what I want to know is, why was there such a disconnect in the planning of that to make sure you have a comprehensive visit? I didn't quite understand why that wasn't provided. And I'm looking at it from a consumer's perspective, but also from an investment perspective.
I think what you're describing is basically the big factor that is, so actually one thing we didn't touch upon is you can have this next new clinic, but brands matter a lot in healthcare. Healthcare is complex for most consumers. And so that is why you see Stanford Medicine advertising and Kaiser advertising and Sutter advertising. And also what has happened is that as a part of that whole exercise, you started seeing local monopolies emerge. And these local monopolies are basically becoming vertically integrated. It's like the IBM of healthcare. You buy the primary clinics, you buy the urgent care clinics, you have the hospitals. And then you are able to actually increase the prices in an area. So an average procedure in the Bay Area costs 40% more than Southern California. Shouldn't be any other reason except that the insurance companies can say this is fair and they can charge more and then they can take a greater cut of the administrative fee. So what you're describing is one of the key challenges that remains in healthcare, which is if you have to sort of do an integrated provider, somebody who's going to do this primary care bundle, then you are going to have to sort of service the diversity of the population and all the needs that they have with all the technologies and products and all of that stuff like that. And that is why you're finding that the more profitable venture capital businesses or private equity funded businesses are the ones which are actually doing a narrower service and doing it more efficiently and are able to then kind of plug in and get reimbursements out on that end. But over time, you could see how these things, sort of when you become large enough, you become like what you're replacing.
UCSF did a study on telemedicine providers where they used the standardized patients that medical students practice on, and they basically had them pretend to be customers for basically every telemedicine company, and they consistently, they performed well in everything, except they consistently ordered what would be standard of care testing, whether it's imaging, blood work, et cetera, because through that channel, they were pushed cognitively biased to not order what would have been the best opportunity for the patient, at least under current standard of care. So I think this is a consistent problem. This is one that we're in a temporary period where we will evolve towards more and more at-home testing, their pocket ultrasound. This is a temporary area, which is very important in near-term economics and consumer experience. Absolutely, it's an important thing, but this is something that is evolving.
So it seems like as we close,
I think we have one minute, but we also have one other person.
One other question.
The other round.
Go ahead.
Let's see.
Go ahead.
It might be good.
Thank you. Actually, my question is, Bambi, you just mentioned we've been talking about the actual health care costs, and a lot of comes with the fact that it's a lot of waste of having double screening, double labs, and so on and so forth. Would you agree that the reason behind it is the fact that the healthcare, as much as it's evolved, as much as it's much better than what it is 10 years ago, with all the EHR, PMR, and tracking devices available out there, there is a communication gap between all the physicians, between the pharmacists, between the tracking devices, and so on and so forth, and everyone is pretty much are more concentrated on business side, on provider side, rather than on a consumer side. And if there was one kind of centralized platform or software system that would gather all that information, that would save a lot on the healthcare costs, including not to do the waste on all the double screening, doing and providing actually more comprehensive healthcare.
So let me just let me qualify that too, saying that it's actually helpful for providers to have the interoperability. That's the question you're asking, is for each system to talk to each other. That helps the patient and the provider both, by the way. So it helps with patient treatment, patient outcome, and decreases the cost and inefficiencies. And the chief medical officer or ex-chief medical officer of Kaiser was talking about how our system is broken and it needs a transformation or a reboot instead of iterations. I'm just going to throw that question to the panel to see what do you think.
I'm happy to try to knock it quickly. Yes. So I was able to help create and then scale the first ubiquitous use case of interoperability and how we got the prescription electronic. And then I was able to watch and participate, and Dave much more so now, on how we solved prior authorization by building 3- and 4-sided networks. I'm not disparaging the question when I say we all simplistically would love to envision one smart layer that could do all of this. I will instead say, very encouragingly, there will be no one layer, there will be no one platform. On the other hand, there's not one technology problem in the question that you just asked. And yeah, no. I'm saying it is not a tech problem. It is predominantly a political and oligopolistic problem. But even if, I'm not saying that legislators have to move, I'm not saying CMS has the answer, it will be unwound. All of the answers are already here with us, and the winning platforms of tomorrow, they will do that seamlessly. I just have all confidence.
Always strong answer, Scott. We are going to be punctual, but you guys could stay here. I'm going to bring up Anthony really quickly.
Good evening, everyone.
One of our sponsors. Yeah. Yes, and come over here, Anthony.
Thank you very much to our panelists. That was a brilliant discussion. My name is Anthony Shaw. I'm a principal with Avison Young. We are a technology-focused office brokerage, helping early and mid-stage companies find and develop their office-based strategy, which, as you're likely aware, is very, very expensive here in the Bay Area. When I was first hired by one of my first technology clients back in 07, 08, it was all about recruiting and retaining talent, which is very difficult here, regardless of the industry in the Bay Area. And they would want things like, how do we recruit employees? How do we recruit the best talent? And crazy ideas came up, like go-kart tracks in the office and rock climbing walls. And I think that one thing that I've noticed in my industry, and I just thought I'd just mention this before we break for the HP Innovation Showcase, would be that we have seen a bigger shift in the office leasing world, which is employers wanting to add wellness the office environment as a big hook. So a very small piece of content that I'm working on that will come out on Vator and elsewhere in the coming months will be looking at the rise of wellness as an office item, and not just a cool rock climbing wall or something. So I mentioned that. Thank you again to HP and to Vator for this wonderful event. We're proud, Avison Young is proud to be a sponsor, and I know we're breaking for the Excellent. I'll pass it over to Mark.
Sure.
Ready?
How many of you are from the healthcare? Raise your hand. Yeah, that's what I was hoping. Okay, so can you hear me well? So we're gonna split in two groups, but I want to introduce myself. My name is Mark. I'm coming all the way from Barcelona. I don't have so much knowledge on the healthcare overall, but I do have knowledge on the opportunities that healthcare and 3D printing can promote. So we have a lot of applications, a lot of interesting applications in 3D printing for the healthcare industry. We have them on the innovation showcase that we're gonna see in a bit. I also introduced John. John is our expert in VR. You want to say something, John?
So I've been with HP for 15 years, mostly in R&D. We have developed some of the products that you guys will see here. We have, the healthcare booth for our showcase today. We'd love to answer any of your questions as we take a look at the product line. And if you have questions, we'll be in that area to answer any of your questions.
Exactly. So that's a big group to lead. So just feel free to stand up, get some drinks. I'm going to be on the colorful with a lot of lights at the end. That's what the 3D printing is. It's not a class. And John is going to be next to me with the
I'll be next to the bar. We'll be there.
And guys, start walking back in at 7:20. Grab a glass of wine. We're starting promptly at 7:25.